Today we're going to be discussing a little bit about the iM8 series from Eden Instruments and some of the options for CO2. We've had a lot of questions recently since we released an internal water trap based CO2 device with regards to the differences between that and our original offering from Philips Respironics. So I have in front of you here today two 12-inch EdanUSA iM8 patient monitors. Their standard parameters are EKG, respiration, NIBP, SpO2, and temperature. We do feature optional end-tidal CO2. There are two options, internal or external. I'll explain the differences in a minute. You will also notice that all of our monitors ship with open IBP ports, and so the invasive blood pressure parameters are shipping standard. The boards are built into the machine. We used to charge extra to have those ports open. We are now just shipping with those ports open at no charge. The only thing that you would have to buy if you wanted to enable those ports is a pressure transducer interface cable that converts the side of the machine to the disposable kit of your choice. We have BD, Hospira, Edwards, and a couple other options available for you. If you do look on the side of this machine, you'll notice that the CO2 port is closed. Traditionally, we've shipped with an open CO2 port, and I'll show you on the side of this machine. And that open CO2 port features a LEMO connection that adapts to the Philips Respironics LoFlo module. This has been our CO2 solution up to this point. All the machines have come with that open port, and you can add this at any point, or your customer can add this at any point. Unfortunately, there are a couple drawbacks to it. It does come at great expense. It is more expensive both up front and in the long term as far as consumables are concerned versus a traditional internal water trap driven CO2 solution. Up until this point, last quarter, Eden did not have an internal CO2 solution using a traditional water trap. That's changed with the addition of the Eden G2, standing for Generation 2 CO2 system. Those of you familiar with Chinese patient monitoring as a whole will understand that most international manufacturers are using this Philips Respironics module from an OEM standpoint. It's very costly and challenging to get a CO2 solution through the FDA and 510K process, so most manufacturers have elected to go that route. That changes going forward with the Eden G2 CO2 system, and I'll flip this monitor around here so you can see the water trap position and the scavenger gas line position. The Eden G2 water traps look like a traditional water trap. Goes into the side of the unit, actually would go this way, and then terminates with a lure lock. The good news is, in the past we've been stuck using Respironics OEM cannula, and I'll show you those options from their support booklet, but at substantially elevated cost. A generic cannula like this might have an end user price of $3 to $5 depending on quantity and configuration. These cannula were $10 to $12 end user prices and up, depending on which cannula you went with or sampling line. So the cost savings is substantial. These water traps are good for multiple patients for an extended duration of time. The machine will notify you when they've become full or occluded, and you simply replace them. These carry an end user cost of $25 to $30 depending on quantity, and again are good for many patients. So your overall patient cost is lower with the Eden G2 CO2. Also, your customer's initial expense is less, as the G2 CO2 module is less expensive. It is built into the side of the machine, as you can see. It's just above the printer port. Let me grab the Philips Respironics sample cannula capnography accessory box, and I'll show you a few of these. You can see here, this is the low flow sample cell that all of their cannula terminate with, machine side. They go into the Respironics module here. Some have dehumidification or Nafion tubing built in for the longer duration patients. You can see that there's a few different options, these being the most popular, with CO2 on one side and O2 delivery on the other side, the 3469 ADU. The standard are the 3468 for adult, and then you can see the pediatric and infant sizes as well. Moving forward, we will stock and carry both monitors that have an open CO2 port and monitors that have Edan's G2 CO2 built in. This will allow your customers to always have choice to upgrade to CO2 after an initial purchase simply by buying the Respironics module itself. If they know they want CO2 up front, they can save themselves some initial money up front in the cost of the unit and then some recurring and supply-driven expense as they move down the use of their monitor. Of course, if you have any questions on the Eden iM8 or any of our patient monitors or products, including the new Eden G2 CO2 or the Respironics LoFlo sample cell, we're happy to answer any of your questions. You can also visit us at www.EdanUSA.com or give us a call at any point and we'll do our best to take care of you. Hope that clears up some of the confusion that's been going on about the Eden CO2 options.